Observing and reporting skin changes in patients. During daily care, a patient's skin should be observed for changes that may indicate injury or disease. Home health aides should observe and report the following signs and symptoms to the supervisor immediately: pale, white, reddened, gray or purple skin, blisters or bruises on the skin, differences in temperature of the skin when compared to the area around it, complaints of tingling, warmth or burning of the skin, dry, cracked or flaking skin, itching or scratching, rash or any skin discoloration, swelling. Observing and reporting skin changes in patients. HHAs should observe and report the following signs and symptoms to the supervisor immediately. Continued: cuts, boils, sores, wounds or abrasions, fluid or blood draining from the skin, broken skin anywhere on the body, changes in moistness or dryness, changes in existing injury or wound size, depth, drainage, color or odor, redness or broken skin between the toes or around the toenails, scalp or hair changes, skin that appears different from normal or that has changed. In darker complexions, look for changes in skin tone, skin temperature and the feel of the tissue as compared to the skin nearby. Pressure injuries, pressure ulcers, bed sores. Immobility reduces the amount of blood that circulates to the skin. Patients who have restricted mobility have increased risk of skin deterioration at pressure points. Define the following key terms. Pressure points: areas of the body that bear much of the body weight. Bony prominences: areas of the body where the bone lies close to the skin, and the skin here is at a much higher risk for breakdown. Pressure injuries: injuries or wounds resulting from skin deterioration and shearing. Also known as pressure ulcers, pressure sores, decubitus ulcers or bed sores. Pressure injuries, common sites. The most common areas are bony prominences, back of the head, ears, the area under the breasts or scrotum, shoulder blades, elbows, lower back, sacrum, tailbone area, buttocks, the area between the folds of the buttocks or abdomen, hips, skin between the legs, knees, inner and outer parts, ankles, heels, toes. The pressure on these areas reduces circulation, decreasing the amount of oxygen that the cells receive. Warmth and moisture also contribute to skin breakdown. Once the surface of the skin has broken down and is weakened, injuries can occur and may become infected, causing damage to the underlying tissue. Pressure injuries, stages. If caught early, a break or tear in the skin can heal fairly quickly without other complications. However, if not caught early, a pressure injury can get bigger, deeper and infected. Pressure injuries are painful and are difficult to heal. They can lead to life-threatening infections, especially in the elderly or ill. Prevention is very important and is the key to skin health. There are 4 stages of pressure injuries. Stage 1. The skin is intact, but it may look red, and the redness is not relieved after removing pressure. Darker skin may not look red, but may appear to be a different color than the surrounding area. The area may be swollen, painful, firm, soft and warmer or cooler when compared to the area around it. Pressure injuries. Stages. There are 4 stages of pressure injuries. Continued. Stage 2. There is partial thickness skin loss involving the outer and/or inner layers of the skin. The injury is pink or red and moist, and may also look like a blister. Stage 3. There is full thickness skin loss in which fat is visible in the ulcer. slough or eschar may be present. Slough is yellow, tan, gray, green or brown tissue that is usually moist. Eschar is a dead tissue that is hard or soft in texture and black, brown or tan, and may be similar to a scab. The damage may extend down to the tissue that covers muscle. Pressure injuries. Stages. There are 4 stages of pressure injuries. Continued. Stage 4. There is full-thickness skin loss extending through all layers of the skin, tissue, muscle, bone and other structures, such as tendons. The ulcer will look like a deep crater, and slough or eschar may be visible. Unstageable pressure injury. There is full-thickness skin and tissue loss, but the extent of damage cannot be determined, because it is covered with slough or eschar. Once the slough or eschar is removed, the injury can then be staged, either stage 3 or stage 4. Deep tissue pressure injury. The skin area is intact or non-intact and is deep red, purple or maroon. The wound may appear as a blood-filled blister. The area may be painful and may be warmer or cooler than the surrounding tissue. Discoloration may be different in darker skin. HA's role in prevention of pressure injuries. Immobility reduces the amount of blood that circulates to the skin. Patients who are bedbound are at an increased risk for skin deterioration and pressure ulcers. Breaks in the skin can cause serious, even life-threatening, complications. It is much better to prevent skin problems and keep the skin healthy than it is to treat skin problems. No. The following guidelines should be followed by HAs to provide good skin care and prevent pressure injuries in patients. Report changes you observe in a patient's skin. Provide regular care for skin to keep it clean and dry. Check the patient's skin daily, even when complete baths are not given or taken every day. Reposition immobile patients often, at least every 2 hours. Provide frequent and thorough skin care as often as needed for patients who are incontinent. Use skin protectants. Change clothing and linens often as well. HA's role in prevention of pressure injuries. The following guidelines should be followed by HAs to provide good skin care and prevent pressure injuries in patients. Continued. Do not scratch or irritate the skin in any way. Keep rough, scratchy fabrics away from the patient's skin. Report to the supervisor if a patient wears shoes that cause blisters or sores. Avoid harsh soaps or laundry detergents. Report to the supervisor if a patient has these products in the home. Never massage white, red or purple areas on the skin and do not put pressure on them. Elderly patients have very fragile, thin skin. This makes the skin more susceptible to injury. Be gentle during transfers. Avoid pulling or tearing fragile skin. Overweight patients may have poor circulation and extra skin folds. Pay attention to the skin under the folds and give regular skin care. Report signs of skin irritation. HA's role in prevention of pressure injuries. The following guidelines should be followed by HAs to provide good skin care and prevent pressure injuries in patients. Continued. Serve patients well-balanced meals. Proper nutrition is important for keeping skin healthy and intact. Nutrition affects the color and texture of the skin. Very thin patients may be malnourished, which puts them at risk for skin injuries and poor wound healing. Be gentle when moving and positioning them. Keep plastic or rubber materials from coming into contact with the patient's skin. These materials prevent air from circulating, which causes the skin to sweat. The patient's care plan may include instructions on giving special skin care for dry, closed wounds or other conditions. Follow the care plan and ask the supervisor if you have any questions. HA's role in prevention of pressure injuries. For patients who are immobile or who cannot change positions easily, HA's should keep the bottom sheet tight and free from wrinkles and the bed free from crumbs. Keep clothing or gowns free of wrinkles too. Never pull the patient across sheets during transfers or repositioning. This causes rubbing and friction, which can lead to skin breakdown. Place an absorbent bed pad under the back and buttocks to absorb moisture or perspiration that may build up. This also protects the skin from irritating bed linens. Absorbent pads are also available for wheelchairs. Relieve pressure under bony prominences. Use pillows or other positioning devices to keep elbows and heels from resting on the surface of the bed. A bed or chair can be made softer with flotation cushions or special foam overlays. Patients seated in chairs or wheelchairs need to be repositioned often too. Reposition the patients at least every hour if they are in a wheelchair or chair and cannot change positions easily. Safe patient handling, positioning. Patients who spend a lot of time in bed often need help getting into comfortable positions. They also need to change positions periodically to avoid muscle stiffness and skin breakdown. Positioning means helping patients into positions that promote comfort and health. Remember, bed-bound patients should be repositioned at least every 2 hours. Patients in wheelchairs or chairs should be repositioned at least every hour. Which position a patient uses depends on the diagnosis, the condition, as well as the patient's preference. The care plan will give specific positioning instructions. When positioning patients, HAs must use proper body mechanics to help prevent injury. HAs should also check the skin for any problems, such as whiteness, redness or warm spots, especially around bony areas, each time they reposition patients.